Catalina, I'm just going to start by saying that Kepa Institute organizes this, and Kepa Institute is the appointed institute to organize EFT training here in Singapore. And my name is Eng Chuan. Let me introduce you, Catalina. I first met Catalina many, many years back when I was attending a workshop in Bern, Switzerland. She was there facilitating with Les Greenberg, conducting a couples workshop. She completed her doctorate degree in clinical psychology at York University. That was where Les Greenberg was based, and of course, her supervisor was none other than Les Greenberg. She has extensive training in EFT, both for individuals as well as for couples. And right now, she is a trainer and, of course, a supervisor and organizing and delivering a workshop internationally. She does research. Her research focuses on understanding how forgiveness unfolds in couples. And there's a book written by her called Letting Go and Forgiveness. I'm not sure if I got the sequence correct. It was published in 2019 by APA. Catalina is originally from Chile. That's something I found out more recently. She's now based in Switzerland, Lucerne. I just checked. She teaches the graduates program at Webster University. She spends time with her family and as well as her yoga practice. So I now want to officially welcome Catalina. Thank you for taking time to join us and sharing with us this topic that is your favorite about how you work with couples, especially using the Greenberg and Goldman's model. So thank you very much, Catalina.
Wonderful. Thank you, Angshuan. It's a pleasure to be here. Thank you to the Caper Institute for inviting me. I'm sorry, I'm coming down with a little bit of a cold, so I'm
It's okay.
coughing a bit. I've also just been seeing a couple messages come up on my WhatsApp. I think there might be people in the waiting room, at least from my network, who were unable to come in. And I also
Okay.
wanted to say hello to them because I've got several, it looks like, some colleagues in my network who are attending this, and that's wonderful. So let me first start off by giving you an overview of the webinar that I've prepared for us for today. So I'm going to firstly give an overview of couples therapy because I understand not everybody maybe in this group is familiar with working with couples. I do understand that some of you have a background already in maybe systemic therapy, or maybe you're already trained in emotion-focused therapy through one of Johnson's institutes. And so I want to take some time just to give a sense of what this model is about, also the origins of how it works or how it's evolved, right? And then certainly really highlight the unique features of the Greenberg and Goldman model compared to the Johnson model, which is the original. It's actually Greenberg and Johnson. So I'll be spending most of my focus on that. But let's start off with a quick background. So I'm going to share my slides with you, and here we are. So thank you, Angshuan, for that beautiful introduction. As Angshuan mentioned, I'm currently based in Switzerland. I mean, I've been here for 12 years now, but I spent most of my life actually prior to this moving between Chile and Canada, and completed my PhD with Les Greenberg. So one of the really fascinating things about working with couples is actually seeing the progress that can be made when you start in a situation where there's either open hostility, or maybe, when people are kind of at each other's throats, so to speak, and they're um, basically having so much tension that it's hard to intervene. Or possibly you've got a couple, like in the photo here, that doesn't even talk anymore, right? They don't talk to each other. There's still a sense of distance and hostility, but it's not as pronounced. And the thing that I find fascinating about working with couples is how you can move from this state to eventually something more uplifting and hopefully uh, joyous, even though that's obviously not going to be the entire point of life. The fascinating thing about working with couples is you actually see the impact quite quickly of your interventions and your work. So the research that substantiates this model that's been around for over 30 years actually highlights so many things. One, and briefly, right? Because I want to get to the unique features of the model, but let me just say that we've got an understanding that we've got the model is effective in a relative short-term period of time. So in 12 to 24 sessions, we can also already see therapeutic gains where couples are indicating that their levels of relational satisfaction are much more solid and superior to when they came in. There's a line of research on the impact of getting along with your partner on your physical health. So it does good things for your body. Or another way of saying this is it's actually really difficult to not be able to get along with your partner, or there's something really toxic and damaging about not being able to actually to not get along with them, right? Um, excuse me. And so what's also really important is that there's been improvement shown in couples across different countries. So it's actually valid cross-culturally as a model, and it's also valid developmentally across different age ranges. And it's also a valid approach to working with with partners where one partner, or couples, I should say, where one partner has any type of comorbid situation. Comorbid situation meaning a clinical difficulty. So just to give us some background, this model was originally developed in 1988 by Les Greenberg and Sue Johnson. And as I mentioned, there's a substantial body of research around it. It's a humanistic approach that incorporates elements of systemic therapy and experiential therapy. So we work with the here and now, and we certainly work with the focus on what's happening in terms of the process over the content. And so process actually means trying to perceiving what's happening in the room between the partners and being very attentive to that, rather than giving priority to the narrative or the content of what they're saying. We're also, as the name of the model implies, deeply interested in helping couples understand what's happening for them emotionally. And the central idea with this model is we help people move from kind of a reactive position where they're expressing what we call secondary emotion to primary emotions that promote a more empathic response from the other partner. So I'm going to get into that in just 1 second here. I'm a very visual person, so I've included an image of an iceberg. And I want you to consider the analogy of couples in conflict as being, maybe like two icebergs in the ocean. Not that they're particularly hostile or dynamic things, these icebergs, but the idea is to capture the distinction between what you see on the surface, right, of an iceberg is just the tip of it. And when we are talking about that with reference to couples, what we understand is that what couples are expressing in conflict is only part of what's really going on. And so what couples express in conflict are basically protective, reactive emotions that help them survive this current conflict. And some people are more prone to attacking, shall we say, and some people are more prone to moving back. In either case, that's only part of what's happening. So I invite you to just consider this piece, right? What you see in conflict is obviously just a piece of what's happening. What's underneath the water and being submerged is actually what we're going to work on in therapy, because the focus is to eventually bring to the surface all of the emotional experiences that couples are unable to express because it probably feels very unsafe to do so in the context of, a lot of hostility. So we first make a distinction between what's a secondary reactive emotion, what's a primary emotion. And over the course of therapy, we help partners identify their negative interactional cycle so that we can understand what are the emotions that maintain the cycle. I said to you a moment ago, this therapeutic approach integrates systemic thinking, right? It integrates the systemic view that couples function as systems that are self-sustained and self-organizing. And the understanding is that what organizes them is the expression of emotions when they're in conflict. So if one partner is attacking the other, excuse me, it's very likely that the other one will either counterattack or will withdraw. And if one partner is expressing, anger and contempt, the other one might express anger and contempt back or might just disconnect. Whereas if you have partners who are engaged in a positive cycle, which does happen, right? And one partner, shares something with the other and is able to open up quite vulnerably or, show vulnerability, the other one responds with compassion. And so this is what organizes how the system functions. What we want to do over the course of therapy is help partners be responsive to their partner's vulnerable feelings. In other words, things that are underneath the surface. This is a very busy slide, okay? But it's a way of kind of illustrating what we understand to be the negative interactional cycle between couples. So we've got this couple in the middle, right? We've got two partners. And what we are seeing is just the tip of the iceberg. There's a behavioral thing that they're doing, right, on both sides. And what they're expressing is secondary protective emotion, right? And what are they protecting? So this is very interesting and important. Well, they're protecting usually the pain that comes from unmet attachment and identity needs. So the understanding in this model is that there's a lot more happening, obviously, to what you're seeing when couples are in conflict. And that couples aren't fighting just for the heck of it, obviously. They're trying to get their adult needs for closeness and connection met from their partner, and also their needs for validation and recognition, which we call identity. Now, what is amazing is that one partner's expression of secondary emotion, see how there's this little arrow in the middle, is going to immediately activate the primary emotion in the other partner and vice versa. And so we call this a cycle because, for example, the more one partner here expresses maybe criticism, anger, right? Let's imagine this partner on the left is trying to seek more closeness from her partner, right? And when her partner finally comes home after a long day's work where he's worked extra hours, instead of saying, "Oh, I'm so happy to see you. You're finally home. We can hang out and do something fun. I've been thinking of you all day," she says instead, hmm, right? And the might mean it's a of disapproval that he probably knows really well. And she might maybe then say, do they pay you that much to stay more? Have you asked for a raise? And there might be something critical in her tone that he recognizes, or rather that his amygdala recognizes, and that primes him to respond in a particular way. And what's really important here is to know that information travels much faster to the amygdala than to any other structure in the brain. And so if your approach currently is to work with couples cognitively and help them maybe problem solve, I've got to tell you, this is going to be really difficult when people are emotionally activated, which is the case when they're having distress. Why? Because you can't talk people out of their feelings, right? So if this partner, as I was saying to you, is feeling actually quite a little, I don't know, abandoned or rejected because the other partner is spending so much time at work, right? She might know, this approach is probably not such a helpful one, but it's so painful to feel, here the primary emotion, right? Sad and alone, right? And rather than showing him that, she shows him anger, and the anger activates his primary emotion, which we might imagine might be a feeling of shame. I'm just making this up, right? I'm going to show you a video in a second, but I want you to get a sense of how this process works, right? It's the partner's expression of secondary emotion that actually amplifies the pain that the other partner is already feeling, or the core emotions that they bring into the relationship as well around relationship needs. I'm saying a lot of very technical things, but I hope this will become clear in a second when I show you a video. Okay? When both partners experience a primary emotion that doesn't feel safe to show to the other because maybe they don't feel the other one will be responsive, maybe there's already open hostility, they resort to expressing secondary emotion. So maybe the husband here might actually notice, uh-oh, she's just grumpy and she grunted at me, right? And then she said this thing about, do they pay you that much money? Which is a bit of a snarky remark, right? Which, he might take as, oh no, now I'm being criticized for not being assertive enough to speak to my boss or not earning enough or whatever it is, right? But maybe it touches a feeling of being somehow insufficient. And when this partner feels insufficient, their secondary emotion or their protective thing to do is to step back. And so they withdraw, right? Or they disengage. And the more they disengage, the more this partner feels alone. So what do? They express even more anger and irritation. And so we understand that couples are caught in this cycle. And this is our initial starting point, right? I'm going to show you a video now because I think it's really important for you to get a feel of what this therapy is about. Even if you're already trained in other models of couples therapy, even if you're already familiar with the model that Sue Johnson proposes in her training, it's actually the same model with the exceptions I'm going to highlight after the video, right? But this way, hopefully, you'll get a flavor of what I'm talking about when I say to you it is both an experiential and systemic approach. I forgot to mention as well that you're welcome to type in any questions you might have in the chat box, and we're going to take some time at the end to go through them. So feel free to just type away in the chat. The couple I'm going to show you now is actually a demonstration couple that is a real couple. They come into therapy wanting help from Les Greenberg, who's agreed to see them. This is a demonstration video published by the American Psychological Association, and they're having a lot of conflict around parenting. So this is just a little snapshot of what the therapy looks like.
For the most part, but
Yeah.
there's other times where I'll just get up and either, get the girls dressed or, again, just give in and just go with the flow on it.
Right. But those aren't the arguing times, right?
Yeah, absolutely. Yeah, that's actually the arguing times,
Sometimes he'll just back down and be quiet,
Right.
and then he's mad, he's sullen,
Yeah.
and that's not good because then the kids see it. Now there's no communication.
Yeah. So let me understand. So one of the patterns might be you sort of disagree or don't agree with what's going on, but in order to not get into things too much, you kind of bite your tongue or your lip, right, and you sort of hold it in, but then you get down, you get sullen, maybe withdrawn, right?
Yes.
And then you're not communicating. You notice that he's withdrawn, right? And then what do you do?
Um, initially in our marriage, I would just keep, honey, talk, no, 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 honey, let's talk about this. And he's always like, just leave me alone for a while.
Yeah, yeah.
And I'm like, no, let's talk now, now.
Yeah. So you really are kind of in the pursuing position, right? You're really after him. Yeah.
But I think now I'll give him maybe 5 or 10 minutes. Still not much, but I'm learning.
Yeah.
And then, but certainly by the end of the night, I'm like, well, I'll try to talk to him about it. And sometimes he'll talk if I'm quiet long enough.
I see.
And sometimes I'll just have to be quiet for quite a long time for me.
Yes.
And then he'll talk to me and we'll maybe reach a middle ground, or we'll just start arguing again if we just can't reach a middle ground.
Yeah. So what's happening for you when you're going after him?
I'm super frustrated.
Yes.
Because I think I'm very, I don't know, what is that, type A? I'm ready to just talk right now. Let's get, let's address this now. I can't rest.
Yes.
Let's talk about this now.
Right. So on the one hand, you're very active in trying to get the communication, but it must be uncomfortable to just, you've sort of had to hold yourself back, right?
Right.
and you've said you've done that some, right? And it has some positive effect if you give them enough space.
Right, if I relax them, yeah, I think so.
But actually, I'm imagining that inside it feels, you know, I mean, I don't know you well yet, but maybe even a little lonely, or kind of, it's like, I want the contact, you know, the touching.
Right.
It's kind of hard for you if a wall goes up. It's kind of you being closed out.
Yep,
and it's kind of a loneliness inside. Yeah?
That's true.
Yeah. But what he gets is a kind of agitation, right?
Yeah.
But so a tear comes to you, right? Because it touches the loneliness. Yeah. So, can you say a bit more about that? I mean, it's.
I just, I don't know.
Yeah, it's just sort of just like, I need connection. I need you to talk to me.
Yeah.
When the wall goes up, it just leaves me like so alone.
Right.
Yeah. I just need you to reach out to me so that we can be in contact, right? Yeah. Did you know about your wife's loneliness in a sense?
Yeah, I can definitely see it.
Yeah.
And
but if I can just interrupt, sorry.
Sure.
What actually happens for you right now inside as she cries? You know, how is it? Do you tense up a little?
A little. I know that she you know, deeply cares about me. You know,
and about the connection.
Absolutely. And you know, about our differences and trying to work it out. But as she said before, and I think you hit it right on the head with, I will put up a wall, you know, and at that point, you know, I need to be left alone.
Yeah.
You know,
so something pretty important is happening for you, in which putting up the wall is your kind of way of dealing with it.
Okay. So I'm going to stop it there, because I think that gives you hopefully a sense of how this therapy works, or what it looks like, at least, with the understanding that, you know, there's a lot of emphasis on understanding both partners' internal experience versus the content of what they're fighting about. That's just kind of more of a surface level thing that activates the pain that they each carry. And they each have different, there's a different flavor to their pain. So for her, it's loneliness, right? There's a sense of loneliness and sadness that she feels around feeling disconnected. Whereas for him, you didn't see this in the video clip I just showed you, but he actually has more of a struggle around feeling inadequate. And so he pulls up a wall, and he doesn't quite know what to do when she's in that state. She just knows he feels a little bit overpowered by her, or unsure, right? And there's a lot going on. Hopefully you notice the therapist's warm and also directive style of working, right? Where he's able to immediately say, I understand, that very quickly and succinctly summarizes what might be happening for her in a non-defining way, right? And he uses a mode of empathy called empathic conjecture to try to bring to the surface what hasn't yet been said, but what seems to be implicit in what's happening for her in the moment, right? She's tearing up. He then does this, again, you didn't see this in the video clip, but he does this with the husband as well, right? Tries to get a sense of what happens behind the wall for him. And hopefully you got an understanding of how, I mean, this is Les Greenberg, so that it's so brilliantly and skillfully done, the way he actually summarizes the interactional cycle between the partners. And so this is a really important starting point in the therapy, but that's not all of it, right? I'm now going to continue with the presentation. Excuse my throat, goodness. And move into talking about, well, both resolution and the defining features or unique features of the Greenberg and Goldman model that set it apart from the original model developed by Greenberg and Johnson. So just one more note, resolution in this therapy involves the movement from partners expressing secondary emotions, right? That are their ways of kind of protecting against their painful feelings. So there has to be a recognition that they're each doing that. And then ultimately, there has to be an expression of vulnerability offered to the other partner, and the other partner has to be able to respond in an appropriate manner. So there's a lot of research, not only on the outcome, we have a lot of an understanding of the different populations this therapy works for, but there's also a lot of research looking at the process of how these really important change processes occur. And one of the biggest ones is what I'm highlighting to you now, is the expression of vulnerability. And there is both a lot of research around how you facilitate that and what are the kind of key ingredients that determine good outcomes. And there's also a lot of emphasis in our trainings about how therapists can promote that. So that's kind of the magical thing, or one of the magical techniques. I don't like calling it that, but that therapists trained in this model learn to do. Make the implicit come alive and bring it into the room so that couples can actually are able to respond, or partners are able to respond to each other. Okay, very quickly, I've been mentioning this throughout, it's important to understand that the original emotionally focused therapy model was actually developed by Les Greenberg and his then graduate student, Sue Johnson. So the first reference to this model was in 1988. That's a long time ago, right? Since then, there have been different evolutions. Sue Johnson then went off, once she finished her PhD with Greenberg, to continue to really emphasize the transmission of this model, and did a phenomenal job actually making this model known. And so there's a lot of misunderstanding around who developed the model, but just so that you're clear, they co-developed this model, right? Les Greenberg was the Sue Johnson's professor. They published this. He then went on to develop individual EFT, so working in the same kind of framework from an emotion-focused way with individual clients, and alongside other collaborators like Robert Elliott and Jean Watson, Rhonda Goldman, they developed EFT for individuals. In 2008, Les Greenberg and Rhonda Goldman wrote another version of EFT. So EFT-C, this is what I've been referring to as the Greenberg and Goldman model, is actually offers a much more comprehensive understanding of what happens in the context of couples conflict. Why? Because they actually elaborate on three really important systems. Attachment, which was the original formulation that Greenberg and Johnson used in 1988, and excuse me, this throat, so annoying. Identity, which is another system that has to do with the need to have one's identity recognized and validated, and then a third system called attraction. So that's actually much more elaborate than the original thinking that was proposed in this book that came out in 1988, which was on attachment, right? So the understanding is that people were in conflict because they were seeking closeness, right? And when closeness wasn't offered, they were getting into difficulties, and there was hostility and there was tension, right? And this is the understanding that remains very much present today in the Johnson's model, okay? Whereas Greenberg and Goldman have developed this framework in a much more elaborate way. So I'm now going to go through the distinctive features of the Greenberg and Goldman model. I've just mentioned to you that there are these three motivational systems that actually underlie couples functioning. Attachment refers to the need for proximity, availability, and responsiveness. That's one system. In parallel, we've got another system operating. So it's not like you're either or. All people need to feel safe and secure, and that their partner is responsive to their needs, or their loved ones, are available for them. And in parallel, we all have the need to feel seen, to feel validated, to feel respected by our partners, right? And people around us. And so it's both attachment and identity. it usually happens that one partner will have kind of a more emphasis or be more organized around one of these dimensions than the other. But this is a really important distinction. It means that couples are not only getting into conflict because of a difficulty around proximity, it's also because they may feel that in terms of their identity needs, these are not being met. Then there's a third system that they call attraction and liking. It's different from attachment, right? This is the dimension where excitement, pleasure, play, sexuality, all of these things are encompassed in this attraction and liking system. And it basically reflects the emotional bond, the pleasantness of being in a relationship that draws partners to each other. So I've included this image here from you inspired by the film In the Mood for Love, because if you've seen that film, you'll understand that degree of energy that you can feel in the presence of two people who have such a strong attraction to each other and a liking to each other without with it being different from attachment per se, right? So a little bit more to say about identity now. That's one big difference that exists conceptually in the ways that we understand couples to function. Now, in the clinical aspect, we understand, according to this model of Greenberg and Goldman, that we can have conflict and interactional cycles based on unmet identity needs. So we call these influence-based cycles. Why? Because we've got one partner that's actually trying to get recognition and validation, or in other words, to have influence over the other, but they're doing it in a way that has actually become quite toxic. So the most common configurations of this have to do with, well, dominance and submission. You've got one partner who basically takes over all the time, consistently considers themselves to be the leader, and the other partner may initially go along with this arrangement because there is on some level some ease in it, believe it or not. So if you're with somebody who knows exactly what restaurant they want to go to, who knows exactly what film they want to watch, who can kind of just take over, initially that might be okay. The difficulty starts to emerge when the submissive partner starts to question this arrangement and say, I'm not so sure I like this, or I want to have a say in this, or how come my voice is never really heard in this relationship? Then there's tension around the system. And so we've got typically what ends up happening is the one who's in the dominant position doesn't want to give that up. And so starts to kind of insist on that even further, right? And there's another element related to having influence, which is referred to as the role of being the one who defines reality. And what's actually really complicated about this is that the dominant person starts to define the other one as being somehow inadequate or not capable of making the same decisions, for example, or in more extreme cases, starts to define the submissive one as being the sick one, the pathological one, the one who came from a family that wasn't maybe as whatever functional as theirs, and they get into a role of defining the other. And so because they hold this power, they actually resist the submissive one from being able to, the submissive one is not a nice term, I understand, but the other partner who is in the submissive position is unable to actually ever have their voice heard, because every time they try to, the other one overrides them by saying, what do you know anyway? I'm the one who's, whatever it is. And I've seen all sorts of things happen from, I'm the entitled one because I've studied psychology, or I'm the one who's better with feelings, or I'm the one who knows how to manage money, so you don't have anything to say about this. But essentially, what's really important in terms of a distinguishing feature here between the Johnson model and the Greenberg and Goldman model is that we are talking about power dynamics in the therapy. We are talking about how couples are interacting in this dimension. And we also, in our trainings, give therapists concrete tools to be able to work with dominant partners. Our understanding is that dominance is actually a secondary response, right? If we go back to the image of the iceberg, that's just what's happening on the surface. but it's actually really problematic and it actually scares a lot of therapists. I do a lot of supervision where this becomes kind of the common stuck place, right? And typically therapists will say, I can't work with this person, or I just don't like this person, and da 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 da. And it becomes really difficult because it's then hard to support the more submissive one when we've got this other one overriding them or interrupting all the time. And so we give our therapists, who attend our trainings, the skills that are necessary to work with people who are dominant, have dominant behavior, with the understanding that underneath the dominance, there's actually a lot of pain and there's a deep primary feeling typically of shame, right? And inferiority. It's not enough to know this conceptually. It's actually really important to be able to work with this clinically. And so that's a really important distinction that happens in our trainings and in this model is we talk about power and we talk about influence. Then a third distinguishing feature of the Greenberg and Goldman model is that we emphasize over the course of therapy, right? This doesn't happen initially at the beginning, but we want couples to, over the course of therapy, once they've been able to respond to each other's vulnerability and compassionately attend to each other's pain, we actually want them to be able to take responsibility for the pain and the wounds that they bring in to this relationship, right? So rather than kind of always being in the position of seeking or demanding even a response from the other, a soothing response, right? We start to do what's commonly used in individual EFTs. We call them they're basically therapeutic tasks that come from individual EFT in the context of couples therapy. This is not something we do for all couples because some couples don't need this. This is actually reserved for couples where one partner, or maybe both, but it's particularly useful if you're working with a partner who's had trauma. So if somebody has experienced complex trauma in particular and lives with a deep fear of either abandonment, right, or a deep, deep feeling of being unlovable and worthless, it's actually really difficult for the other partner to soothe them because the wound is tremendous, right? And it's important to insist again, this might be repetitive, but I'll just tell you again, the model works so that initially we're trying to promote responsiveness from the other partner. So there's the expression of vulnerability and the other partner responds to it. It might happen that we do have somebody who's got trauma, whose wound is so deep, who even when their partner is loving and attentive and responsive to their needs, still feels unlovable, still feels afraid, still wonders, will they leave me, right? Is still calling, I don't know, 8 times a day to make sure that their partner is still attentive to them. The other partner is feeling, by the way, probably a little bit overwhelmed by this demand. There's a mix of compassion and also fatigue, right? And a need to have a certain amount, of limits respected. What we end up doing in that case then is promoting what we call a self-soothing task. And this is the work with the inner child, right? And we do this in the context of couples therapy. And we do this by instructing the partners. We're very transparent in EFT about the work that we're doing. And so, for example, I'll share with a partner that I'm seeing we're kind of getting stuck here in this place of feeling like even though your partner is able to respond to you in a really loving and compassionate way, somehow it doesn't quite stick or somehow it doesn't quite land. And I wonder if today we could focus on helping you maybe take care of that pain on your own, right? And would you be willing to do that? So I always get consent and I always orient the couple. And then I engage in this individual-based task while I have the other partner witnessing this. And usually what ends up happening is that it's a really deep process where the person goes back to working with their inner child, the wounds that they have often accumulated from childhood. Often it's cumulative, right? It started in childhood and maybe there were other relationships or abandonment or experiences. But what's really beautiful about this piece of work is the responsiveness that it elicits from the witnessing partner. So the therapist is working one-on-one with the one partner. in the presence of the other partner, and this goes on for about 45 minutes, we debrief the session, and time after time, what the witnessing partner says is usually one, they're weeping, right? So they're just so deeply touched by seeing their partner's pain. And two, there's this really kind of spontaneous overflow of compassion for them, right? And so it's deeply healing for both of them, because it's also such an act of courage for the one who's gone back to working through their trauma in the presence of their partner, right? This is not two therapies in parallel. This is a piece of work that we do in the context of couples therapy. So I want to make that really clear. And I also want you to remember, we don't do this with every couple. We only do this with couples where there's trauma, and we do it at stage 4. So this is the final slide I have around the distinctions. We use a 5-stage model. So Greenberg and Goldman offer a very clear, succinct roadmap of the things that therapists are to do over the course of therapy, right? It starts obviously with alliance formation and validation, moves into cycle de-escalation, and then at stage 3, then and only then do we get into vulnerability. Do you see? So we are not immediately getting people to open up their hearts and talk about their deep pain, because we need safety. And once we have safety, we have safety, obviously. Once we have vulnerability in the room and partners being responsive to each other, we're moving into stage 4, which is around restructuring the bond. And this is where we will do self-soothing work if that feels appropriate. There are also, other tasks that we do at stage 4, and at stage 5, we're consolidating and helping the couple integrate and have a clear understanding, both of them, of how it is that they get into conflict, what they bring into the relationships in terms of their vulnerabilities, and how they get the cycle going, right? By this time, usually towards the end of therapy, it's less likely that they're caught in their cycle, right? We've already de-escalated, but it's really helpful to have couples give a deep understanding and offer that back to the therapist of how they understand their cycle to work. Why? Because initially, when people come in, they're blaming each other and they're saying, oh, if only my partner would blah, 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 blah. Oh, if only she would blah, 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 right? And they're holding the other responsible as the agent of change. After going through this therapy and over the course of therapy, both partners are able to take responsibility for the sensitivities they bring into the relationship, right? And also be hopefully more capable of soothing their own pain and their own distress. And then towards the end of therapy, have an understanding of their contribution to the conflict. And that's really important. The last thing I'll say about this is that in our trainings, I said this a moment ago, but we are very interested in this whole approach in understanding kind of the process behind the model. So it's not just a theoretical thing. We're actually really involved in getting process research conducted so that we understand how to facilitate different processes. And one of the things we do in the trainings is we spend time trying to work through the resolution of emotional injuries and the facilitation of forgiveness, right? And so this is something, as Engshwan mentioned, that I spent a lot of time investigating, and I co-authored a book with Les Greenberg on the subject. And it's something that we offered to our training participants so that you then have an understanding of an empirically based model for how to work with couples where there's been an emotional injury, which is kind of a more elaborate term of saying a betrayal, right? And betrayals take different forms. And even though we're saying, I said a moment ago, people take responsibility for their own feelings and so on, they also have to take responsibility for their behavior, and that includes for having hurt the other person. So I'm aware of the time, and I just want to leave you with a couple of summary statements. I'm not sure where you will go from here, but hopefully you'll sign up for the training, right? And you'll have a much clearer understanding of the interventions that we use in EFT-C for working with couples in distress. But I want to give you just some clear kind of quick snapshots of what to do. Well, firstly, follow the pain, not the content, right? And this is very tricky because people say a lot of things, and we are very we're prone to actually prioritizing narrative over the process. But if you start to actually keep an ear open for what's the pain related to this, your therapy is going to be a lot deeper. And the pain, according to this model of Greenberg and Goldman, is related to unmet needs of attachment and identity. The other thing that's really helpful to do is to help link the behavior to the underlying emotion, right? So if you're working behaviorally, I mean, that's an important start, right? You need to help people see, oh, this is what you do. You yell and you criticize. Now, what we do in EFT-C, and what I would invite you to do, is to actually start maybe hypothesizing, inquiring, exploring around what might be happening underneath that iceberg, right? What's happening underneath the surface? Perhaps you're actually feeling lonely, right? And framing it as a question, right? Similarly, over here, I've indicated, reflect the underlying emotion, not just the content of what people are saying. I hear the anger in your voice, and I also see the sadness in your eyes. So sometimes there are these mixed states that are happening, and it's really, really important to differentiate these in terms of their, the emotional expressions. And then lastly, this one takes a little bit more work, help the couple understand that they are caught in an interactional cycle, right? So I've been trained in this model by Les Greenberg and also Rhonda Goldman, and I feel systemic therapy is a really important lens to be using here, as is emotion. And my hope is that you'll be able to join me and participate in our upcoming training. I want to thank you for your participation and your presence, and leave you with one final slide of research support that I won't go through, but you can read over on your own. I'm now going to turn it over to Ingxuan to see if
Yes.
there are any questions.
Yeah, so thank you, Catalina, for that very illuminating difference in terms of these two different models. So we have a couple of minutes for Q&A. Please take this rare opportunity to put out your questions to Catalina. I would encourage you to speak. That's more interactive. But if you feel like you're more comfortable typing in the chat, that's fine too. So please take this opportunity liberally.
So you can unmute yourselves. I saw a couple of thank yous in the chat box. So great that you could be here. Yeah, wonderful. I'm glad you enjoyed the video illustration as well. I saw a couple of comments on that. Okay, good.
So there's this question by Hong about how many levels. There are three. So it's like the individual, there's 1, 2, and 3. So the one that's coming up, the one that I'm going to show you in a moment, would be the level 1, or what in Singapore we call it module A.
So we've got the didactic modules where we're actually covering the theory, obviously elaborating a lot more on what I presented to you today, doing experiential outbreak groups. So the best way to learn this therapy is to actually practice it and to use your own material, right? So we invite our participants to actually work through the interventions that we use by doing a role play where somebody role plays the partner, and the feedback from the participants, who initially might be a little bit shy about it, is that it's extremely useful. And in some ways, it's like a 2-for-1 deal because you get to learn the theory, but you also get some version of therapy, right? There's something actually quite healing about working through this, even if it's stuff you've already worked through. It tends to be generally really well received by people. And then we've also got supervision. So in addition to understanding what's happening theoretically, it's helpful to be able to film, record your sessions, and then bring them to supervision so that you can get direct feedback from us.
And so if I could just chime in on the real play.
Yeah, of course.
This is a really interesting feature about EFT training. And in the individual workshop, we actually bring our real content. And in the couples workshop, we also bring real content. So if I were to be a participant, I would real play myself, which is me, and then I will script my partner, and someone in the practice group will role play my partner. So that's real play as well, and that's really interesting, like what Catalina has said. There's a question in the chat. Let me just read it out first.
Sure, yeah, please.
Bhavani says, thank you. Love the explanation regarding the importance of process work with couples. It is very insightful, even though this is a short talk. So that's Bhavani. But let me just get on to the other one, which is Cheng. He or she wants to know how many sessions on average are needed for couples to complete the 5 stages of treatment.
Yeah, this is a really good question. Thank you for bringing this up because it's actually really hard to answer. But what I always say to couples is that the research findings are based on their short-term, basically, therapies, and that means 12 to 24 sessions. So you can see results in 12 to 24 sessions, is the short answer. Obviously, there's going to be variability, right? If there's more complexity, it's going to take more. Sometimes people see results much earlier on. But anyway, I use that as just the general time frame.
Hi, Catalina. May I ask a
Hi.
question?
Mm-hmm.
Hi, yeah, I have actually attended externship in EFCT in June, but thank you for your kind of like succinct and clear summary on the couples work model, which is actually very similar to what what I've learned in the workshop. But I guess my question is, so you have actually given a very clear elaboration on what kind of issues that might come up in the new model's way of working with identity issues. So I was just curious, like, how does this model work with attraction issues?
Oh, that's great. I forgot to mention that. So, yes, I was referring to that there was a slide with like, these are the 3 motivational systems. These motivational systems actually are kind of what we understand to be part of the framework. So it's more conceptual. In clinical practice, we're actively tracking cycles that are based on attachment and cycles that are based on identity. What's really beautiful about working with this model is that the third system of attraction and liking has, that there's like an organic shift or many shifts that happen when the first 2 models, attachment and identity, are in harmony or, people are feeling aligned with regards to that. Somehow the liking comes back. You can think of the liking and attraction dimension almost as a thermometer. So for some couples, especially the couples that are coming to therapy early on, maybe in the relationship, one of the things that they describe is that lack of maybe excitement or the lack of pleasure in being with their partner, and that's distressing, or they're kind of the sense of indifference. And so it's kind of a gauge of like something's off, and people find this alarming with good reason, right? That we're in relationships because we want to have these feelings of pleasure and joy and love and excitement, and when those go away, people get worried. So when they come to therapy, we kind of do a little assessment about kind of when did that shift or how did that happen. And the understanding, though, is that we don't actively do anything to that. We don't work behaviorally and say, I don't know, go on a date night or whatever. We're doing, it's the same kind of model I outlined to you. And when things get realigned, poof, that kind of beautiful, magical energy comes back, right?
Mm,
So we don't touch it. It's kind of like the nice byproduct of these 2 principal systems of attachment and an identity somehow being calibrated and realigned. Yeah.
I see. Thank
Yeah.
you.
You're welcome. That's a great question. I often forget to elaborate on that piece. Yeah.
There's a question from Chloe. I'll just read them out. And she
Mhm.
says, I'm curious if EFT-C is always done with both partners in sessions. would there be times where individuals be recommended to have their own sessions, for example, for those who experience trauma?
Yeah, so in our generally speaking, we're always meeting with both partners. And the only exception is if we're taking a history and we're which we do with both partners in the room, but there happens to be kind of something that gives the clinician a sense of, ooh, there might be something kind of worth maybe digging into more individually for a person. If, for example, they have a complicated psychiatric history, right? If there are questions around commitment, right? So if you sense that maybe one partner is much more invested than the other, or maybe the other, I'm sensing is actually not as motivated to be here, I want to check that out. So there are exceptional situations where we will meet individually, but it's not consistently done. I know that that's one of the things that's done in the Johnson model, kind of as a standard way. Here, we kind of assess it and take it kind of case by case.
There's another question, and I'll just read them out. It's from Hong. What is the evidence for EFT-C with non-heterosexual couple?
Yeah, I mean, the research findings are very similar to heterosexual couples. So I think I have that in maybe the last page of the slides. It's also similar, consistent evidence for cross, when they study couples in different cultures, so outside of North America, outside of Europe. So it's somewhere around 75%, 75 to 80% of couples report substantial gains after therapy.
I think we might have time for just one last question. Okay, there is one last question from Elias. Let me just read it out. How are the interventions for emotional/attachment injury similar/different with Johnson's model, attachment injury resolution model? And what is the clinical rationale for the difference?
Yeah, so Johnson's group, there's a person called McKinnon who did also a lot of research on forgiveness and came up with the AIRM model, something like this. And it's similar. I mean, I don't have time to summarize all of the distinguishing features, but similar but different, right? So, excuse me. Just very quickly, one of the key findings that my research showed is that what's really important is for the person who hurt the other one, so we'll call this the offending partner, whether that was with, by having an affair or being absent during a critical time for the other partner, like the death of their parent. What's really important is the expression of shame. So that's one of the key differences between this model. I don't think McKinnon really elaborates on that. They talk about apology, and the model that I developed with Les Greenberg also involves a heartfelt apology, but we were able to kind of tweak it down, and I spent many, many years actually trying to identify, so what's the key ingredient of an apology, a heartfelt apology, and it is the expression of adaptive shame. So it's the shame about having done that act, not the shame of I'm a bad, bad person, because that actually has the opposite effect, that somehow blocks the process, and then the other partner has to kind of console the other one and say, you're not so terrible, even though you kind of abandoned me while my mother was dying, or even though you were having an affair with your secretary. So it really skews the process. But this finding was actually and remains a really important feature of this model. I could say so much more about that, but I know we have to end. So I want to thank you again, Angshuan, for the invitation. Thank everybody for attending this little webinar.
Yes, thank you very much, Catalina, for the talk as well as responding to our curiosity. Let me just take the next 2 minutes doing the advertising bit, shamelessly call that. And so this is the workshop that's being lined up. Let me just run through the main details. It's an online live, and of course, Catalina would be the trainer. She's going to deliver this workshop. We'll be done over I think 9 days period from 13 to 16 and 26 to 30th, and each time straddling 3 hours in Singapore. And if you are in Europe, it'll be quite early for you and it'll be quite cold, I think. And that's 8 a.m. to 11 a.m. So a total of 27 hours of training. And these are the rates that we are going to charge. And if you are a participant in the past, we will give you $100 off just to encourage you to expose yourself and gain further knowledge in terms of working with couples. And one last slide before I let you go is that there are a series of training that's coming up. We'll send this out before we end, and we have workshops coming up in October, as well as a module one that's coming up. This is for individual in December, and Catalina is going to deliver the online workshop in January. So thank you very much for your time. And if you have any questions, please feel free to write to us, and we'll respond to you as much as we can. So once again, Catalina, thank you for your time and helping us understand this a lot better. And I look forward to seeing you again soon.
Yes, it's been a pleasure. Thank you, everybody, for attending, for your wonderful questions and beautiful energy. I hope to see you again in January.
Yes. Okay.
And
Thank
thanks
you.
for all the hearts. It's so lovely. Wonderful. Okay, have a great day, everyone.
Thank you.